So I'm here with my like Stu said, my name is Jackie. I'm here from the New York City Department of Health and Mental Hygiene in their Office of Emergency Preparedness and Response. So some of my colleagues are in the back. Sean, Maddie, Judah. So if you haven't stopped by our table yet, we're going to talk about some of the materials that are there in this brief presentation, but make sure you kind of check that out to see what we're talking about. So the health department, we are responsible for responding to public health emergencies in the city. Does anyone know what public health emergencies may look like in New York City? Yeah?
It's like an epidemic, like an outbreak of like what we had here with the Ebola.
Exactly.
Flu breakout,
Yeah, so for those that didn't hear what she said disease epidemics, outbreaks. So things that we've seen in New York City like that are like Zika, Ebola, Legionnaires, right? You were raising your hand as well? Yeah, so even those like active shooter, right? There are tons of emergencies that have health impacts too, right? So it's not only public health emergencies that have health impacts. So we put together some slides for you that talk specifically about Harlem and some of the things that we think you might see or face here in Harlem, and then some tips on how to prepare for that. So, yeah. This is it right here. So what do we think are maybe some of the three most likely things, public health emergencies we may see here in Harlem? Yeah. Hint, if you went and spoke to the folks in the back, you may have a hint. Yeah, so definitely like mental health things. In the back, what'd you say, Miss?
No, they took mine.
No? Yeah, so the three in particular we're going to talk about today are things that we're in the midst of or are coming up. So things like heat, right? We know heat, extreme heat, it's the number one natural disaster killer of people in New York City. We don't realize that, right? Because it's something we deal with all the time, and we don't realize what a threat it really is. So we're going to talk about heat. We're going to talk about flu, right? We're going to talk about flu. Flu is another thing that happens every year, and we don't realize how big of a threat it is as well. And we're also going to talk about coastal storms, right? So some hurricanes, other kinds of storms that may impact this area. We're on an island, right? We may not realize that. But thinking about what that means and what that means for each of us as residents of this city. So yeah, no worries. All right, so we're going to just go rogue since we don't have the presentation. So those three things we were talking about, those are some three hazards we expect to see in Harlem, right? We think we may encounter here in this neighborhood. So we as a health department, we plan for these emergencies based on a few different things. So based on things like the probability of it, so how likely it is to happen, right? We know heat is something super likely to happen. We know the flu is really likely to happen, right? It happens almost every year, multiple times a year. So we go by probability. We go by manageability as well. So how easy is it for us to respond to that? Are there things that are available to us as a city, us as New Yorkers, that we can do to prepare for those things? So we know we could all get a flu shot, right? We know we could wash our hands. So those kinds of things to prevent. The third is around planning impacts. So how easy is it for us to kind of coordinate a response to that and make sure that everyone that is in this city understands the things that they need to do to prepare for those different things. So those are the three things we think about when we think about how do we prioritize which kinds of public health disasters we plan for. So when we're thinking about that, we think about who is most like vulnerable in our neighborhoods to disasters, right? We want to make sure we're checking on one another, that you know who is at risk, whether it's in your building, on your block, in your neighborhood. So what are some things that you think might make someone more at risk for public health emergencies? Yeah. Exactly. So aging, oftentimes, seniors are a lot more susceptible to that. Anything else? Yeah, so maybe they have a disability, maybe they have a mobility disability, maybe they have a cognitive disability, maybe mental illness. Did you have your hand raised as well? Yeah, so maybe they have a medical condition, a chronic medical condition. Maybe they have medication that needs to be taken, that needs to be refrigerated, things like that. So we want you all to know the things that we think make folks a little bit more vulnerable for you to be aware of, and checking in on your neighbors are things like you said. So the elderly, people that are aging, children, right? People that have disabilities, people that have chronic health conditions, but also other things like your access to transportation, right? Are you able to evacuate your home? Do you have access to a car if the subways are down? So things that we may take for granted every day that we use, that during an actual emergency may not be up and running and ready for us to use, right? So just making sure we're aware of those things and know how to prepare for them. So in the response guides that my colleagues are giving out in the back, we give different kinds of scenarios based on the things that we think are most likely to happen in Harlem, that we plan for and we respond to as a health department and as the city of New York. So like I mentioned, for the flu, we have things like just knowing to wash your hands, knowing to cover your cough, knowing to get your flu shot. Does anyone know where they can get their flu shot? What'd you say? You got yours today? Oh, great. So you could get it at a pharmacy. You could get it from your doctor, your primary care doctor. You can get it from a health center in the neighborhood, a hospital in the neighborhood. And it's important to get your flu shot every single year, not only for yourself, but also to protect others in your neighborhood that may not be able to get that flu shot. And then it also talks about in the heat response guide, knowing where your cooling center is. Has anyone ever been to a cooling center? Yeah, so oftentimes, did you go to a library or across the street? Oh, yeah, so sometimes they're in community centers, sometimes they're in senior centers, youth centers. So knowing the ones that are nearby to you so that you can go to those. Because the most important thing during a heat emergency is that you're staying hydrated and you're staying cool, right? So we want to make sure you're wearing lightweight clothes, loose clothing, and that you're drinking water even when you may not be thirsty, right? Because we want you to stay hydrated and protected from that heat. The last thing that we were talking about was coastal storm. So knowing what your hurricane evacuation zone, I know we have this sign over here and they were giving out some materials about knowing what evacuation zone you're in. Our friends at New York City Emergency Management do that. In Harlem, a lot of parts of Harlem are in evacuation zones, so making sure you know that. And you could go to nyc.gov/knowyourzone to find out, and you could put in your specific address to see if you're in an evacuation zone. We also have some tips in the background coping with mental health and stress during a disaster, right? We know during an emergency, sometimes that stuff's exacerbated, and we want to make sure that we know how to deal with that trauma and know kind of how to react to other people around us. So we have some information about NYC Well. Is anyone familiar with NYC Well? No. So it's a free mental health resource. It's 24/7. You could call them, you can text them, you can chat them online, and you'll be immediately connected to a licensed clinician that can help talk you through and connect you to some services and referrals if you need that. So being aware of some of those resources that are out there, and making sure in your go bag that you get today that you also have your prescription information as well. So we have something on our website, nyc.gov/personal health summary. I know it's super wordy, but the information's in the back there. And that's just a way to make sure you know what prescriptions you're taking, what your dosages are, who your doctor is, how to contact them, because say there is a fire in your home and that fire extinguisher doesn't work, or there's a flood in your apartment, we want to make sure you're able to maintain those medications that you may need. So I'm sorry that the maps didn't work out and all of the information, but we have those guides in the back. So if you want to take a copy of them or take some for your neighbors or your friends, feel free to grab them, and we could talk more to you about it in the back. So are there any questions? Yeah.
NYC Well, is that a website or is that a phone number?
It's all of those.
How's that translate to the phone number?
Yeah, so we have a brochure in the back that has the number. Can you tell us what the number is, Judah?
The number is 1-888-692-9355. Again, that's
1-888-692-9355.
9355.
So in addition to that number that you can text, you can also call, and you can also go to their website, and they have a chat function as well. So we try to make it as accessible as possible, folks that may not use computers and things like that. Yeah.
You can also contact directly if you don't have
Awesome, thank you. So for those that didn't hear, you could call 311, and they'll, if you say mental health, they'll immediately refer you to them as well. Yes.
Pneumonia shots for 23 pneumococci, and also for Lebanon will give a recommendation of 13. And if you ride the subway and the buses, that's where you pick it up. Somebody sneezes, somebody coughs, and you get infected, and 3 days later you're out. So I think that it's a good idea to make sure you get those vaccinated.
Yeah, definitely. Thank you so much. So just to reiterate to the group what he's saying, just make sure you're checking in with your primary care doctor or with a health center, with someone that can kind of advise to you the best vaccines to take, because we want to make sure we're preventing disease, not only for ourselves, but for the people around us in our neighborhood. Any other questions? Cool. Thank you all so much. I'm going to pass it back over to Stu.
Thank you, Jackie. Jackie Moran and the New York City Department of Health and Mental Hygiene.